This is Joe Freudenberger, CEO for Oak Bend Medical Center, coming to you today with another Cup of Joe conversation about healthcare topics. We are celebrating Health Information Professionals Week this week, and I am joined by our Health Information Management Director, Carol Bartek, who has been in this field for 46 years and 11 years with Oak Bend. Thank you so much for joining our organization. It is a credit to us to have such a professional leading such a critical department.
Thank you, Joe.
So what we're going to talk about today is tell us a little bit about health information management. What makes it, well, first of all, tell us what it's all about.
Okay.
And then we'll go into kind of what makes it fun, what are the challenges. We'll go from there.
Okay. So the Health Information Management Department and profession deals with the medical record, data integrity, data mining.
Well, let me stop, because maybe a health medical record makes sense to everybody, but just to be sure, what is a medical record?
So a medical record is a compilation of all the documentation that is created while a patient is a patient at the hospital.
Okay. So every hospital has a medical record.
Correct.
Got
Every
it.
patient has a medical record.
Okay.
So we
Right.
keep them separated.
Okay.
Everybody's a unique person, has a unique number.
Good.
We separate out visits by visit ID so that we can look at historically what's going on with our patients. This is important for patient care. It's important to every patient to know what's going on with their health care. So this is the documentation that we maintain. We make sure that it's maintained accurately. There's different T's that need to be crossed, I's that need to be dotted. So the Health Information Management Department is responsible for auditing and analyzing the accuracy of the medical record. We assist the ancillary nursing doctors with the creation of documentation. We are well versed in the rules and regulations related to documentation. They're accrediting bodies that oversee a hospital. They have criteria, and we assist with trying to make sure everybody is doing things properly.
So in the record, in the medical record, we'll have physician notes,
Mm-hmm.
physician orders, nurses' notes, results from radiology, x-ray and things like that, results from the lab. Basically, everything that is done to a patient is recorded in the medical record. Is that correct?
That is correct.
And you guys make sure that it is all organized and accurate and available for future use, because not only does the patient potentially need it, but doctors who may treat the same patient later need to know what has happened during the course of their hospitalization or outpatient care.
Absolutely.
Perfect. So what are the challenges in this field? I can only imagine there's millions of them.
So definitely making sure that everybody has crossed their T's and dotted their I's, as I
Mhm.
said. So we work with the different practitioners, different departments to make sure that they're on target with their documentation. There's also the coding side of things that we do in the medical records department. So in order to bill a claim after
Okay.
a patient's been treated, there's charges that are gathered onto the claim. And then the coders in our department will review the documentation and translate those diagnoses over to a specialized code that goes on the claim form. So oftentimes we're dealing with different edits, documentation challenges that may appear for the coder. And then in the revenue cycle side of things, we're dealing with denials from insurance companies and looking at, the things that we've done to either enhance or not enhance the coding process to get to that point.
So let me back up, because this is really interesting, and I don't think everybody knows this about healthcare billing. But unlike a business where you go to and they got a price on the shelf that tells you how much you're going to pay, we charge the patient the account for the services that are rendered. But sometimes that's got nothing to do with how we get paid. Is that a correct statement?
Correct.
It's got all to do with what has actually been performed, or what the patient's diagnosis is.
Correct.
And that's what you guys do. So you put
Absolutely.
these codes on there that say, hey, we did these procedures, or this patient has, you do both the procedures as well as the diagnosis of the patient.
Correct.
And some of our contracts pay us strictly on basis of if the person has heart disease, if we did a heart cath or what have you.
Right.
That's really interesting. I
Yes.
don't think a lot of people know that because, we all look at the charges
Hmm.
and we figure it's like any other service. We're being charged X and everybody complains about how much we charge.
Yeah.
And turns out that sometimes got nothing to do. Like Medicare, I think, is one of those payers that doesn't
Right.
pay based on what you charge. They pay based upon what you guys code.
Right.
Wow.
So with Medicare population, there's something called the MSDRG.
Oh boy.
So
Well, we're getting into
Medicare,
medical
yes,
terminology.
Medicare severity diagnosis related groups.
Okay.
So they look at populations of patients and have determined that if you have a certain disease process, um, generally you have a case weight related to that, and it then translates to your reimbursement, the hospital's
So the
reimbursement to
more
treat that.
ill a person is, the more the
Absolutely.
hospital gets paid for the service.
Right.
Or the surgery center or what have you.
Right.
Got it.
So the coder is coding the diagnoses. She's making sure that the diagnosis codes are correct. Fortunately, we have software that assists, and it
Okay, all
will
right.
compute that DRG, that MSDRG that I'm talking about, and then we submit the claim.
So the documentation is really critical to
Absolutely.
getting paid properly.
Right.
And I can imagine that doctors are not always that excited about doing all that documentation because they got more important things to do in treating the patient.
Right.
Got it.
Right. So we assist the doctors in making sure that we're clear on what they're stating. And there's processes that we have in place to communicate with the medical staff when we're not sure, and they assist us.
Well, Carol, I've heard that AI is going to transform a lot of aspects of healthcare. And I imagine AI can really have an effect in medical records because you were talking earlier about having to analyze a medical record to make sure it's accurate. I can foresee a day, maybe not today, but someday where AI does that analysis for us.
I agree. I think there's opportunities for AI to help out in those areas with analysis, with coding. There's going to have to be oversight. Like we can't do away with oversight, but I can see where it will enhance the process and help hospitals become more efficient. It will help with data gathering, so that we can see trends.
And I imagine for a health information professional, there's going to be a critical job in taking the findings of AI and then going back to the doctor to try and bridge the gap between the documentation from the doctor and what AI is saying. Hey, this looks like this, but it's not documented quite that way.
Yeah.
So we're going to change a little bit and be more outreach oriented in HIM than we have been, just because of a lack of time. I mean,
Right.
you work under a productivity standard like everybody else.
Yes.
Got it.
Yes. So I see it already in some of the systems available out there with computer-assisted coding. It's gathering the data and it's having the coder review it and help, finalize the codes for that chart. So there's some technologies out there moving
All
there
right.
quickly.
Well, I'm excited about that.
Yes,
that is
me
very
too.
exciting. So what led you into this field? What makes this a great field for people to consider if they're coming out of, it's a college degree that leads you into this? Okay.
Yes. So there's different avenues to get into health information management. As you said, I've been in this field for 46 years. So out of high school, I live in El Campo, and there's a local junior college at Wharton County Junior College. And since then, prior to me even going to college there, they had a program for health information technology. So it's really a good program. I recommend it. It's a 2-year program. You come out with an Associate of Science degree and all the skills needed to work in a medical records department, a doctor's office. As you learn your skills and get that experience, there's so many other avenues that a person can go out and find profitable
So
jobs.
it's a good field. I mean, what makes you happy to be in health information management?
So I am a very detail-oriented person.
Gotcha.
I'm able to do the seat time. One thing that I have always expressed to people is because a lot of our work is in front of a computer in takes focus, we have to be able to do seat time,
Okay.
which is kind of an interesting thing. If you're a very active person,
Yeah.
you may want to choose a different career path in this, maybe consulting or auditing or working for a vendor who
Right.
supports, information systems.
So you're at your desk most of your workday.
Yes. Now there's always the ability to collaborate with other areas and other
Sure.
departments. There's meetings involved.
Right.
What I enjoy is there's a constant learning.
Yes.
There's constant change in healthcare.
Yes.
Nothing has ever been status quo. As soon as you think something's status quo, something changes,
Wow.
and we're all in that education and training mode.
Right. Awesome. Well, thank you so much. This has been very informative. Um, Sounds like a great career, especially if you like to kind of put a puzzle together, because
Right.
that's a lot of what I think medical records is about, is getting the record to make sense and making sure that it is coded properly. So
Absolutely.
I appreciate your time today. Thank you very much for your support of this organization and for your 46 years in this career.
Thank
So
you.
thank you all for joining us today, and I look forward to seeing you on an upcoming Cup of Joe.